welcome you to the monthly Zoonoses and One Health Updates call on December 12, 2018. The content of these calls is directed to epidemiologists, laboratorians, scientists, physicians, nurses, veterinarians, animal health officials, and other public health professionals at the federal, state, and local levels. Please be aware that CDC has no control over who participates on this conference call. Therefore, please exercise discretion on sensitive content and material, as confidentiality during these calls cannot be guaranteed. Today's call is being recorded, so if you have any objections, you may disconnect. Detailed instructions for obtaining free CE are available on our website and will be given at the end of this call. In compliance with continuing education requirements, all presenters must disclose any financial or other associations with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters, as well as any use of labeled products or products under investigational use. CDC, our planners, presenters, and their spouses or partners wish to disclose they have no financial interests or other relationships with the manufacturers of commercial products, suppliers of commercial services, or commercial supporters. The Planning Committee reviewed the content to ensure there's no bias. The presentations will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial support for this activity. Before we begin today's presentation, CDC's One Health Office Communications Specialist, Laura Morrell, will share some One Health news updates with you. Laura?
Thanks, Helen. Hi, everybody. Thanks for joining us for today's ZOHU call, and welcome to all of our new participants. We appreciate you all for helping us spread the word about the ZOHU call and letting your colleagues know that we now offer free continuing education. The ZOHU call audience is really growing, and we now have over 10,000 subscribers representing professionals from government, non-governmental organizations, industry, and academia, as well as students. So please continue to share links to the ZOHU call website, which includes a link to subscribe to the ZOHU call email list and information on free continuing education. To begin today's call, I'd like to share the latest One Health news and resources with you. And these links are also included in today's ZOHU call email reminder. Some new resources that are available include a new tick-borne disease surveillance data summary for 2017, CDC's new Youth in Agriculture Program Overview document, the Interagency Food Safety Analytics Collaboration published Foodborne Illness Source Attribution Estimates for 2016, and then we also have a link to a One Health Workers Survey if you're interested in taking that. Two upcoming events of interest that are happening are tomorrow, December 13th. Dr. Michael Yvonne Frickin will present a One Health approach to investigating vector-borne diseases to the One Health Academy in DC. And March 6th through 8th, 2019, From Consumers to Chefs, Food Safety Education Matters Conference will take place in Orlando, Florida. We've also shared some recent publications, including Institutionalizing One Health from Assessment to Action, Environmental Observation, Social Media, and One Health Action, a description of the Local Environmental Observer Network, an ELISA-based method for detection of rabies virus nucleoprotein-specific antibodies in human antemortem samples, and EID Journal, their December issue, has several articles relevant to One Health. Some highlighted MMWR topics include a multi-state infestation with an exotic disease vector tick, H. longicornis, in the U.S., lead in spices and herbal remedies sampled from home investigations for children with elevated blood lead levels in North Carolina, an outbreak of dengue virus type 2 in Samoa, public health response to an avian influenza A virus outbreak in commercial turkey flocks in Indiana, as well as several notes from the field articles. There are multiple outbreaks under investigation in the U.S., including 3 new foodborne outbreaks linked to tahini, pork products, and romaine lettuce. Several ongoing outbreaks are also listed, and the final update of an outbreak of salmonella infections linked to kosher chicken has been posted recently. As always, a selected list of ongoing and past U.S. outbreaks of zoonotic diseases, as well as information on staying safe and healthy around animals, is available on the Healthy Pets, Healthy People website. If you would like for us to share news from your organization, or if you want to suggest presentation topics or volunteer to present, please contact us at zohucall@cdc.gov. Thank you for your support of the ZOHU Call and for joining us today. I'll now turn the call back over to Helen.
Thanks, Laura. The overall series objectives for the ZOHU Call are shown here on the screen, and today's presentations will address one or more of the following objectives. Describe 2 key points from each presentation. Describe how a multi-sectoral One Health approach can be applied to the presentation topics. Identify an implication for animal and human health. Identify a One Health approach strategy for prevention, detection, or response to public health threats. And identify 2 new resources for CDC partners. Today's presentation topics are bridging the gap between human and veterinary medicine, different patients, same hazardous drugs, using Earth observation data in One Health applications for societal benefits, and cat-transmitted sporotrichosis, a rapidly emerging zoonosis. You'll find resources and links for each presentation in today's ZOHU Call email reminder and on our website. Questions for all presenters will be taken at the end of the call. Call 1-800-593-8936 and enter participant passcode 9611836. Press *1 and give the operator your name and affiliation. Please name the presenter and topic at the beginning of each question. Our first presentation, Bridging the Gap Between Human and Veterinary Medicine, Different Patients, Same Hazardous Drugs, will be given by Dr. Deborah Hurst and Ms. Trudy McCleary. Please begin when you're ready.
Good afternoon. Thank you for that wonderful introduction. So today I'm going to be giving a brief talk about the National Institute for Occupational Safety and Health new veterinary project. And the project is entitled Bridging the Gap Between Human and Veterinary Medicine, Different Patients, Same Hazardous Drugs. This presentation shows many photographs from the field. We do not, however, endorse any manufacturer, products shown, or products that may appear in the photograph. The 2004 NIOSH alert preventing occupational exposure to antineoplastic and other hazardous drugs in healthcare settings introduced a standard of universal precautions for handling hazardous drugs safely. The health effects due to occupational exposure to these drugs are extensive and can include chromosomal and other types of genetic damage, reproductive damage, and exposure can also cause adverse pregnancy outcomes. The NIOSH alert states that its guidance applies to any worker who handles hazardous drugs, including veterinary medicine and animal care workers. For the purpose of this talk, I will use hazardous drugs, chemotherapeutics, and chemotherapy interchangeably, as most hazardous drugs are chemotherapy. Controlling exposures to occupational hazards is the fundamental method of protecting workers. Traditionally, a hierarchy of controls has been used as a means of determining how to implement feasible and effective control solutions. The idea behind this hierarchy is that the control methods at the top of the graphic are potentially more effective and protective than those at the bottom. When looking at the hierarchy of controls in handling hazardous drugs, elimination and substitution typically do not apply, as these drugs are needed for sick patients. Therefore, a clinic or hospital has to rely on engineering controls, administrative controls, and personal protective equipment, or PPE, to reduce worker exposure to hazardous drugs. Engineering controls isolate people from the hazard, in this case, hazardous drugs. Some examples of engineering controls include ventilated cabinets, such as biological safety cabinets, and compounding aseptic containment isolators. These minimize exposure to the worker and environment. Secondary engineering controls include room ventilation, and supplementary controls include closed system drug transfer devices, or CSTDs. It should be noted that CSTDs should not be the only means of worker protection. They should be used as part of a hazardous drug safety program and used in conjunction with other engineering controls. Administrative controls change the way people work. Some examples of administrative controls include properly labeling waste disposal for chemotherapeutics, having chemotherapy spill kits in place, and using signage for hazardous drug storage or when chemotherapy treatments are occurring. The middle picture at the bottom of the slide shows a warning to staff that this patient was given vincristine. This hospital also segregated its chemo laundry, and used yellow blankets to notify staff that the blanket was around hazardous drugs. Personal protective equipment, or PPE, protects the worker. Some examples of PPE include wearing respirators, chemotherapy-rated gowns, and also wearing gloves that are American Society for Testing and Materials, or ASTM, tested chemotherapy gloves, such as the picture on the bottom left corner. And I know it's hard to see, but a lot of times these glove boxes will have the drug name as well as the concentration of the drug, the average breakthrough time, and the average permeation rate. And so that kind of tells you if the gloves are safe to be used around that drug. Now that I've covered the background of hazardous drugs and controls, we can talk about the research NIOSH has been doing in veterinary medicine. We have a funded project evaluating the protective technology and work practices used within human medicine and those used in veterinary medicine for handling hazardous drugs. The ultimate goal is to create guidance that is specific to the unique atmosphere of veterinary medicine, because although veterinary medicine and human medicine are similar, there are big differences. For one, there are over 500,000 veterinary medicine and animal care workers in the United States, majority of which are female of reproductive age. Of these workers who are handling, meaning manipulating or administrating chemotherapeutics, they're exposed to hazardous drug concentrations 15 times higher than a human healthcare worker. Some of the reasons of this exposure include how chemotherapy is administered in animal patients, as well as barriers for not using safe work practices or controls. Cost, time, inconvenience, and discomfort are just some of the reported barriers for veterinary medicine and animal care workers. This is an issue, especially since there are 50% of pet deaths related to cancer, and more owners are choosing to prolong their pet's life. This project has revolved around three key messages to the veterinary medicine and animal care workers. We want the worker to know the risk of the drugs they are handling, how to handle the drug safely, and how to avoid exposure. Here's an example of why this project is important. We were told this story by one of the hospitals we had visited on one of our site visits. Apparently, a vet tech of childbearing age was experiencing irregular bleeding because she was handling metronidazole for her equine patients without proper PPE. The drug was getting on her bare skin, so she just had the scrubs, and the horse would often rub his nose or mouth against her bare arm. And so one of the side effects of metronidazole is unusual bleeding, and a lot of women report having irregular bleeding. Since 2016, we have conducted 7 site visits at veterinary hospitals. We have evaluated engineering controls and collected surface wipe samples. NIOSH chemists are currently in the process of developing new analytical methods for hazardous drugs. We held 2 focus groups, and another focus group was held by a University of West Virginia health communications student. We also conducted testimonial videos from veterinary professionals. Currently, we are developing a prototype for these training modules. This will be a free curriculum where veterinary professionals can earn CEUs. We also plan to update the NIOSH Veterinary Healthcare Worker webpage and develop manuscripts based on our site visits. So these are some of the pictures that we've taken during our site visits. and they show labeled laundry bins, refrigerators, use of transport bags, the use of closed system drug transfer devices, and labeled kennels. And the next few pictures I will be sharing are those that kind of demonstrate why we've really pushed with this project and getting more out there for veterinary professionals. So this shows a picture of a veterinary technician giving doxorubicin to a patient. Doxorubicin, which has a red hue, can be seen on the tech's glove. This is pointed out by the yellow arrow and circle. Also, exposed skin and a watch are also shown. They are not covered. Here's a picture of a veterinary technician sitting on the floor. She's waiting to give the patient vincristine, which is also on the floor. And you can see vincristine is actually in one of those syringes. This picture shows a veterinary technician compounding mustargen in a recirculating hood. And by recirculating, I mean 100% recirculating into the room. There was no percentage out to the outdoors or 100%. It was totally 100% in the room. And during the visit, the shipping department delivered chemotherapy drugs that are on the tech's desk. And I blocked it out because of PI. But you can kind of see the transport bag, but then you can also see a white cap, which was not in a transport bag, and that was chemotherapy. And also in this space, chemo administration is done quite a bit. This picture shows chemotherapeutics on open shelves in the pharmacy, and you can see carboplatin is on the top shelf. This shows a picture of 2 refrigerators that are labeled no human food. During the site visit, we noted that staff members were putting their leftover lunch in these refrigerators. And remember the metronidazole example? Here's a tech putting the powder in capsules at her desk. Prior to placing the drug in capsules, she used a mortar and pestle to grind up the drug. She continued to place the scalpel used to scrape the drug on her desk. No coverings, nothing. She ate lunch at the same desk. And I have to say that this drug, metronidazole, is not on the current NIOSH hazardous drug list, but a big part of the study is looking at workplace practices in veterinary medicine. And so I just want to thank everyone for allowing me to discuss NIOSH's veterinary research. And if you would like additional information, please feel free to contact me, and my information is listed on the slide. Thanks.
All right, thank you so much for that really interesting presentation from NIOSH. Thank you. So our next presentation, using Earth observation data in One Health applications for societal benefits, will be given by Dr. Helena Chapman. Please begin when you're ready.
Hi, good afternoon. I'm honored and humbled to present the topic, using Earth observation data in One Health applications for societal benefits. I am a second-year AAAS Science and Technology Policy Fellow at NASA Applied Sciences program, focusing on health and air quality applications. In this presentation, I will describe the utility of satellite data and their public health applications. I will also present 2 examples where satellite data can form part of the One Health toolkit for public health practitioners, researchers, and educators. The Health and Air Quality application is housed in the NASA Applied Sciences program of the Earth Science Division. John Haynes is the program manager, and Sue Estes and Jacqueline Whitty are associate program managers. And I'm the AAAS Science and Technology Policy Fellow. In the Health and Air Quality applications, our project portfolio supports 4 major objectives. Projects promote the use of satellite data in air quality management and public health. They assess the toxic and pathogenic exposures and health-related hazards. They support the application of satellite data in the implementation of air quality standards, policy, and regulations. Finally, they address the effects of climate change on public health and air quality to support managers and other stakeholders in their initiatives. In our One Health community, we understand that healthy environments are essential to mitigate health risks affecting humans, animals, and our environment. It is important to note that in 2012, the World Health Organization reported that 12.6 million deaths, or 1 in 4, were attributed to residing or working in unhealthy environments. Of those, 6.5 million deaths, 1 in 9, were linked to indoor and outdoor air pollution, the leading environmental health risk. With the globalization of our ecosystem, our world continues to observe the threat of antimicrobial resistance, challenges in vector control, health, environmental, and societal impacts of natural hazards, trends of rural to urban migration, and air transportation as a major industry and mode of travel. Hence, to address these global challenges, we should reflect on a quote by Albert Einstein. To raise new questions, new possibilities, to regard old problems from a new angle requires creative imagination and marks real advance in science, something that we know very much in our One Health community. One such scientific tool includes remote sensing data and technology. Remote sensing is the science of obtaining information about an object or phenomenon without physical contact, usually using satellites or aircraft. For example, the energy that is reflected from the Earth, or the electromagnetic spectrum, can be detected and observed in remote sensing images. Remote sensing has a wide range of applications in different scientific fields, including detecting changes in air and water quality, assessing environmental hazards, and identifying habits of key disease vectors like mosquitoes. These satellite data collect environmental factors that help us better understand the health of our aquatic and terrestrial ecosystems and global air quality. As in our One Health activities, we also find a similar reality as the quote describes by John Muir. When we pick out anything by itself, we find it hitched to everything else in the universe. Using satellite data, scientists can analyze and interpret spatial and environmental relationships. For example, they can use these data and assess air quality trends, such as nitrogen dioxide emissions, or forecast infectious disease outbreaks, such as malaria or cholera. By integrating satellite data into public health applications, we can provide information to achieve global objectives, whether we work domestically, such as Healthy People 2020, or internationally with the Sustainable Development Goals. We can also evaluate strategies to improve communication among scientists and other stakeholders. And finally, strengthen capacity building that can bridge earth and health science disciplines. I'd like to present two examples where satellite data can provide additional environmental health information for our public health projects. First, let's look at harmful algal blooms. In our portfolio, Dr. Stumpf and his research team trained citizen science to collect samples using the HabScope device, which is a 30-second video that provides real-time cell counts from the sampling location. By combining satellite data, such as MODIS and VIIRS, weather forecasts, and sampling from the HabScope device, more frequent and accurate respiratory distress forecasts could be produced 1 to 2 times per day along the Florida Gulf Coast. And more recently, last October, a new smartphone-based pilot information resource, or the 24-hour experimental red tide respiratory forecast, was provided to Florida residents near Pinellas County on the Gulf Coast. This tool is updated several times a day to identify which beaches may be impacted by the hazardous effects of red tides. Second, let's look at air quality. By using NASA OMI data, ozone monitoring instrument data, scientists reported that nitrogen oxide emissions have reduced over the past decade, hence noting that air quality across the U.S. has actually improved. This can be due to policies such as the Clean Air Act, more eco-friendly behaviors from humans, as well as advancements in technology. On One Health Day 2018, our team shared 3 public health projects that used Earth observations. These projects included lowering the heat advisory threshold from 100 degrees Fahrenheit to 95 degrees Fahrenheit to prevent heat-related illnesses in the state of New York, using cholera forecasts to strengthen preparedness and support measures in Yemen, and providing harmful algal bloom health alerts to Florida communities. Finally, I would like to describe 2 upcoming missions. First, the Tropospheric Emissions Monitoring of Pollution, TEMPO, is NASA's first Earth Venture Instrument mission. It will collect tropospheric pollution observations such as ozone, nitrogen dioxide, formaldehyde across North America, hourly and at a high spatial resolution. It represents the North American component, hence forming a global air quality constellation with Copernicus Sentinel-4 of the European Space Agency and Geostationary Environment Monitoring Spectrometer, or GEMS, from Korea. It is scheduled for launch no later than 2021. Second, the Multi-Angle Imager for Aerosols, or MAIA, is the first pure applications health and air quality mission. It will collect radiometric and polarimetric observations to characterize compositions, quantities, and sizes of particulate matter in air pollution. These measurements will be combined with population health records of selected cities to better understand the linkages between different types of airborne particles and human health conditions. These conditions include cardiovascular and respiratory diseases, premature deaths, and adverse birth outcomes. It is scheduled for launch no earlier than 2021. In summary, as One Health practitioners, we should look into the future and reflect on how we can continue to strengthen our One Health toolkit. Satellite data provide evidence of the dynamic processes of our global ecosystem, which can be integrated in our public health applications. As we expand our toolkit with new data-driven technologies and tools, we will be able to facilitate multi-sectoral, transdisciplinary One Health collaboration that connects scientists across disciplines. By bridging the earth science and human and animal health communities, we can better train the global environmental health workforce to prevent, manage, and respond to health risks that affect humans, animals, and the surrounding environment. And thank you very much for your attention.
Okay, thank you so much, Dr. Chapman. So our final presentation, cat-transmitted sporotrichosis, a rapidly emerging zoonosis, will be presented by Dr. Brendan Jackson. You may begin when you're ready.
Great, thank you. And I'd like to start out by apologizing to the transcriptionist and to all of you who don't like fast talking. I will try to speak at a reasonable pace, but I may not succeed. So I'm here to tell you about what may sound like an esoteric topic. Someone once recently told me that. A rare and nearly unheard of fungal species in North America, Sporotrichosis brasiliensis, and the No Rose Gardener's Disease title. If you don't already get the reference, hopefully that'll become clear as we move through this talk. So this is really to help put this on your radar. This is something that in the CDC fungal group we're really just starting to grapple with, but are realizing that we need to get the word out about this sooner rather than later. So I'm going to start with a case. This is about over a decade ago, maybe 20 years ago. There's a cat in Sao Paulo, Brazil, that was owned by a family in a fairly poor area. It was just an outdoor cat, largely had a lot of interactions with feral cats, and started developing ulcerated nodules on their head, ears, nose, and legs. And they ultimately died. And on the postmortem exam, it turned out, this is what turned out, and you might not be surprised based on the title, but the skin tissue was full of these little blue circles, which were yeast. And it turned out to be Sporotrichosis. Now, many of you have heard of Sporotrichosis in terms of Sporotrichosis schenkii, which is pretty much the main form, at least pathogenic form, that we have here in the United States. There's actually dozens, over 50 different species of Sporotrichosis, although only a few actually cause any sort of mammalian or human illness. And so this was characterized as schenkii for a while. And so let's talk for a second about what Sporotrichosis is in general. So in human medicine, and those of you who are veterinarians can tell me how you kind of learn about it in veterinary medicine, we tend to call it rose gardener's disease or rose grower's disease. Partly because that's who often gets it. You know, people are dealing with roses, they get pricked by the thorns. It's not really the thorns itself that transmits it usually, but rather the fact that it creates an opening then for the Sporotrichosis that's on like decaying plant matter, especially things like peat and sphagnum moss, which is shown in the bottom right figure there. Those actually are a great source. In fact, some of you may know Dr. Ann Schuckett. I believe that her first outbreak when she was an EIS officer at CDC was investigating an outbreak of Sporotrichosis among a ladies' gardening club in Alabama. And so this is sort of like the classic sporotrichosis that we think of in the United States. And it typically causes sort of a local cutaneous skin infection. It can sometimes spread more extensively and even travel up the lymphatic system and cause fairly extensive a disease. And immunocompromised people, including people with AIDS, can cause disseminated and very severe disease requiring hospitalization. Okay, so that's the background on sporotrichosis in general and Sporotrichosis. What about this thing that's going on in Brazil? So fast forward to about the early 2000s, and it was determined this was actually a different species that was going on here. Now, in the fungal world, species names are sort of a sore subject because there's lots of taxonomists that are revisiting the old species designations and seeing that they were based on morphology, what things look like under the microscope. And now with all kinds of genetic techniques, we can see that different things are they're sorting things out. Things that we thought were related aren't, and they're splitting species out into tons of different species. And sometimes it's not clear if there's even like a real need for that from a clinical perspective. Well, in this case there is, because Braziliensis behaves very differently than Schenckii. You can see the figure on the left shows the kind of cutaneous lesion that can develop, and then the tracking up the arm along the lymphatic system from there, and then again it can cause disseminated infections. There's evidence both from the laboratory and from epidemiology that this species may cause more severe disease than Sporotrichosis Schenckii, both in humans and in cats. You can see the kind of disease there. That poor cat has an awful facial lesion there, and I'll tell you more about that in a second. So let's talk about how people actually, in cats, get this infection. So as we talked about, Sporotrichosis brasiliensis is much like Schenckii in that it lives in the environment in soil and plant matter. And then the cats come in contact with it. They may get it on their claws and their mouth or that type of thing. And then an infection can start from there. But what makes this one unique is that it can spread from there to other cats. And as many of you know, cats apparently like to fight, especially when they're feral cats trying to defend their territory. And that's apparently an unfortunately great way to spread this feline sporotrichosis. Now, I want to underscore how strange this is to us in the fungal group to see this kind of fungus spreading from mammal to mammal, cat to human, or cat to cat, or cat to dog, as it shows in this figure here. Sporotrichosis is one of these fungi known as dimorphic fungi, meaning two morphologies exist in two different forms. One as like a mold, or the mycelial form with like kind of those hyphae that extend out. This is when it's growing in those environmental conditions at sort of moderate temperatures, like 25 degrees Celsius, kind of room temperature-ish things. And that's when these dimorphic fungi, like some of you may know blastomyces, histoplasma, coccidioides, which causes valley fever. These are all these dimorphic fungi, and they can really only spread to humans or other mammals from the mold form when it produces these fruiting bodies. This one, so that's why, thankfully, we don't actually see person-to-person outbreaks of valley fever or histoplasmosis or blastomycosis, but this type of Sporotrichosis can spread in the yeast form, which makes us very concerned. And as you can see, there's potentially even a role for the sort of murine or mouse spread, but the main thing that we're concerned about is the cat-to-cat spread and the cat-to-human spread. And I'll show you what they're seeing in Brazil here in a second. This is just to give you a better sense of just how infectious this thing can be. So this is a cat that's being examined in a veterinary office for this awful lesion that it has under its ear. It's teeming with Sporotrichosis yeast. Shakes its head, as cats may tend to do when it's being examined, kind of like back and forth really quickly. And the veterinarian that was examining this cat developed a severe conjunctivitis from the Sporotrichosis brasiliensis that got in her eye. So it just shows just how easily this thing spreads. This is a couple figures from some recent papers. The figure on the left shows the increase from the 1990s, when this was essentially a fairly unheard of phenomenon, to 2012, when the number of cases has been increasing dramatically during that time. So just to give you some context, some people may be wondering, maybe this has always been with us and we're just starting to detect it. You're partly right. There's a report from 1955 that documents cat-to-human transmission of Sporotrichosis in Brazil. But it wasn't until 1988 or 89 there was the next report that actually showed, I think, to quote, a very obnoxious 3-year-old male mongrel cat in quick succession wounded 5 people, 3 of whom shortly thereafter developed Sporotrichosis. And so that sort of set things off, and then it was still kind of trickling in until the late 90s when all of a sudden this thing started to take off. And then there were a bunch of publications around the early 2000s when this was named, showing this was a problem. Well, unfortunately, we as a public health community weren't able to get on top of it then, and it has continued to spread. And the figure right, you can see that it was predominantly a problem within the kind of Sao Paulo area, but it's spread to other areas within southern Brazil and now all the way up into eastern Brazil as well. And it's now been reported from Argentina too. So this is not going to be something that's specifically restricted to Rio and Sao Paulo going forward. And to give you a sense of where the trajectory of this is going, in just 2017, we've heard reports from colleagues down there that there's been over 12,000 human cases in the state of Rio de Janeiro alone, not counting all these other states that are affected. And there's actually not formal surveillance from what I understand, that this is all largely from specific clinical referral centers seeing these patients. And the number of cat illnesses is of course untold, given especially that a lot of these, some of these cities have very large feral cat populations. The good news is that this disease actually is quite treatable with antifungals, specifically itraconazole. You can see this poor cat with both of its eyes completely gummed over with granulomas actually recovered a fair amount. Itraconazole works for humans as well, although there are reports describing antifungal resistance both to itraconazole in this organism as well as to amphotericin B, our sort of big gun last resort known as amphotericin for some of the side effects that it can cause. I just wanted to give you a sense of where things are in terms of Brazil. We've been talking with colleagues there who are very concerned about it and trying to get on top of things. They recently held a meeting in a city there, and one of my colleagues was able to attend that. And they're very interested in developing partnerships between the public sector, academia, the veterinary community, the human medical community, and really actually fostering broader One Health work and maybe even organizing a One Health meeting there in the future, because clearly this is a One Health disease, both from the veterinary and the environmental angles. Obviously, we'd like to do more epidemiologic studies to look at ways to intervene on transmission, both between cats and to humans. Here in the U.S., we want to reach out more to colleagues both in government and in the veterinary community and more widely to let them know about this concern. Talking about cat importations. Helena talked about the globalization of things. That's no surprise to any of us, I guess, that we could expect to see this type of disease in any number of places. Luckily, we don't have the number of feral cat populations here like they do in Brazil, but we certainly have quite a number of outdoor cats, and this could be a concern for spread through there. And then globally, we think one of the biggest things is just awareness, making sure people are actually on the lookout for this. We need better diagnostics. This can grow in culture, but it'd be great if there was some sort of PCR or even sort of a rapid like dipstick LFA type test more widely available. And then of course we need to be on top of this in terms of outbreak response, because as we've seen from Brazil, if this there's sort of a saying that we have in fungal diseases: if you neglect it, it will grow, and that's what we want to avoid it doing in other parts of the world as well. So thanks everyone for your time. And I know once the moderator opens it up, I'd love to hear your thoughts and questions. Thanks.
Great, thank you so much, Dr. Jackson, for that presentation. So at this time, we'd like to take any questions for any of our presenters. Call 1-800-593-8936 and enter participant passcode 9611836. Press star 1 and give the operator your name and affiliation. Please name the presenter or topic at the beginning of each question. Alyssa, do you have any questions so far?
I show no questions in the queue at this time, but again, if you'd like to ask a question through the phone, please press star 1 and record your name when prompted. If you need to withdraw your question, you may press star 2. Please stand by for any incoming questions. And our first question comes from Andy Newman. Your line is open.
Hi, Brendan. It's Andy Newman up in New York State. I'm just curious in regards to your presentation, and I think I know the answer, but what is known about where this Brasiliensis is found in the environment elsewhere, either in South or Latin America or elsewhere in the world? I'm thinking not much is known yet, but just thought I'd ask. Thanks.
No, that's a great question. There is actually a decent amount known. I'm not, to be honest, a complete expert in this, but there are some papers describing the phylogenetics of this whole thing. And it's actually not, Braziliensis is not all that distantly related from Schenckii, but it does form a clearly distinct clade or kind of group of isolates, and they're actually highly related to one another. They're much less diverse than the Schenckii ones. And so it's known that this has been found in southern Brazil, I think especially that far southern state, down south of Sao Paulo and Rio. And it really does seem fairly localized to there from what they've seen. They've not detected Braziliensis in any other parts of the world. There is, I believe, another species, I want to say it's globosa, but don't quote me on that, that's in Asia, and they actually have some zoonotic spread as well, but that seems to be a different one. So this, for whatever reason, seems to be sort of an offshoot of this broader Sporotrichosis species complex. It probably had some ecologic niche down in southern Brazil and seems to have found a very fertile home, unfortunately, in feral cats.
And again, as a reminder, if you'd like to ask a question, please press *1 and record your name.
Well, this is Brendan Jackson. I was wondering if I could ask a question of one of the other presenters, and that's about the first presentation in terms of the risks of toxic medications to veterinary staff. I was curious how the sort of level of oversight and regulations differ between veterinary clinics dispensing these types of medications versus human medical clinics that are doing the same, and sort of are there things to be learned from the human side, or things the human side could learn from the non-human animal side?
Hi, this is Deb Herson. I'm Trudy McCleary. I'm not sure about the regulatory. I know some of the states govern that, the state boards, especially with USP 800 coming out. I know on the human side, that's being adopted, but on the veterinary, there was an article that came out that said whether some states are going to follow that guidance or not, whether state boards are actually going to start doing audits. But as far as other things, I know there's like AHA, stuff like that for hospitals, but I don't know how far they go into actual drugs. This is fairly new for us, looking at the actual veterinary side of things. We've always kind of focused the HAS drug research on, we've done a lot of studies on the human healthcare side. And can you repeat the second part of your question?
No, I think you covered for the most part. I was just struck because we investigated an outbreak a couple of years ago that was with some city partners where there was an oncologist practice that was in human medicine that was basically adding their own antibiotics. This is less about the toxic medications, but just the level of oversight in terms of handling of medications in oncology offices, and basically was compounding their own saline with antibiotics, leaving the bags in fridge for a month or more at a time, same fridge where there was visible mold growth and employee food at the time. And it was just interesting to me to see that there actually is not a particularly strong level of oversight in many places in terms of sort of outpatient medication handling from the human side. So I was just interested to see what you had about the veterinary side as well.
So that's interesting. So when we first dabbled into this project, we were told that we would not find any use of engineering controls, such as the primary, looking at the biological safety cabinets, or even the supplementary, the closed system drug transfer devices. Since I can say all 7 have had those. They've had either a biological safety cabinet, whether it recirculated 100% into the room or the pharmacy. we even seen some that exhausted 100% out to the outdoors. And then all of them have used closed system drug transfer devices, and they're pretty meticulous about the beyond use date and other aspects. So we were pleasantly surprised, and but as you see in a lot of the photos, there have been some improper work practices. But we're trying to push through and get some guidance out there. It just, it's going to take some time.
Great, thanks for the question and answer. Do we have any other questions on the call, on the line there, Alyssa?
Yes, our next question comes from Erin Leonard. Your line is open.
Hi, this is Erin Leonard. I'm calling from Nova Scotia in Canada. I work with local public health here. I just had a question for Brendan about Sporotrichosis and whether there's any awareness of the groups that go down south to do like the spay-neuter kind of programs with the vet community.
Thanks. That is a great question and one I do not have an answer to. So if anyone on this call has, you or anyone else on this call has information about this, this is something that we're really, just trying to push now, and so would love to gather more information. But my guess is it's probably not that high, but I have no idea.
Okay. Thanks.
And actually, can you just tell the group a bit more about those spay-neuter groups? I mean, is that a large practice from what you're aware of? Is that a common thing? I've personally adopted my dog from a group that went down to Puerto Rico. Obviously, that's part of the U.S. But just curious if people know that's a common practice for South America as well, for bringing pets to the U.S.
Yeah, I'm not sure how many people go to Brazil, but I know there are quite a lot of volunteer groups that do go down to South America and Central America to do work with either local pets or stray animal populations. So it would be interesting to know if they're even aware of this down that way, but they would definitely have contact with a lot of feral animals or even owned animals that may not be in the best condition.
No, thanks. And if anyone has any sort of suggestions for people to reach out to, groups that are doing this, we might be able to get in contact with, please feel free to email me. It's brjackson1@cdc.gov. That's brjackson1@cdc.gov. Thanks.
Great, thank you so much. Do we have any other questions on the line?
I show no questions in the queue at this time.
Okay, let's wait just another moment or two, see if we have any more.
And I'm still showing no questions in the queue.
Okay, we'll go ahead and end the call now and wrap that up. So I want to describe the continuing education information here. Free continuing education is available for physicians, nurses, health educators, veterinarians, and others. Instructions for receiving free CE are available at cdc.gov/onehealth/ZOHU/continuing education. The course access code is OneHealth2018. To receive free CE for today's webcast, WC2962-121218, complete the evaluation at cdc.gov/TCEonline by January 14th, 2019. A recording of today's call will be posted online by January 15th, 2019 at cdc.gov/onehealth/2018/December.html. To receive free CE credits for the Web on Demand WD2962-121218 video of today's call, complete the evaluation at cdc.gov/TCEonline by January 15th, 2021. Thank you again for your participation. Please spread the word to your colleagues about ZOHU Call's free CE opportunity. Our next call will take place on Wednesday, February 6th at 2 p.m. Eastern Time. Please send suggestions and questions to zohucall@cdc.gov. For more information and to subscribe to our email newsletter, please visit cdc.gov/onehealth/ZOHU. Thanks again to all our presenters and everyone for listening. This ends today's call.
That concludes today's conference. Thank you for participating. You may disconnect at this time.